Hi, I'm Dr. Chen Wen Liu. Today we're going to talk about a bit more of a sensitive topic, but it's a question that I get a lot from a lot of my patients. Am I too old for a hip or knee replacement? I'm an orthopedic surgeon from Adelaide, South Australia, focusing on hip and knee replacements. Whilst we do have a few criteria when determining the suitability of a patient for their hip and knee replacement, one of them isn't age. Now, whilst age can be a factor on our risk profile for the anaesthetic and surgery, it certainly isn't the main one. The first thing that we look for someone who might be suitable for a hip or knee replacement is number one, whether or not they need it. Now, I've made a previous video about that, so you can check that out in the links below or look at our channel for that video. The next thing we look at are medical comorbidities. What that means are the medical conditions that you may or may not have that can impact upon the safe application of the anaesthetic and the surgery. Things, for example, like diabetes, elevated body mass index, things like whether or not you're a smoker or whether you drink a lot of alcohol. Those things are probably the four main risk factors for complications from the surgery. We know that patients who smoke have a much increased risk of wound complications and infection. We know that uncontrolled diabetes have a large impact upon the risk of infection after a surgery, as well as wound healing complications. Things like blood thinners for other conditions, such as warfarin for an artificial heart valve or atrial fibrillation, may well increase the risk of wound complications from ongoing bleeding after the surgery. Things like that certainly add to the risk profile, and we individualize and tailor our approaches to our patients after we know all about their medical history. That's why it is very important for us to get a summary from your general practitioner and also for you to be aware of some of these medical conditions that you may have. We will ask you a series of questions during the consultation, and you may want to bring things up if you do not feel like we've got all the information in your health summary. Now, as part of our decision about whether or not you're too old to have your hip or knee replacement is a discussion and decision about your functional limitations, as well as a frank discussion really about how you're coping and how long you may feel like you've got to live. Now, although we don't know how long we're going to live, and it's a bit of an absurd question in its own right, it does mean that we have to consider whether the risk profile of having a joint replacement matches with the amount of discomfort that you're in and the benefits of having that joint replacement on your rest of your life. Now, let's just say you are 90 years old and you're fit and healthy and you are likely to live for another 5 to 10 years. Then if you said to me that you had a lot of trouble with walking, negotiating your shoes and socks, getting changed in the morning, getting in and out of the car, and performing all of your normal activities without pain in the hip, then absolutely we would consider you for a hip replacement. I would much rather consider a hip replacement for someone who is 90, who has no medical problems, has no major anaesthetic issues, than to consider someone who might have uncontrolled diabetes, who was a smoker and was overweight but only 60 years old. That 60-year-old would have a much higher risk profile than our 90-year-old. So it's certainly the case that whilst age is a number, it's only a number and does not constitute the number one reason why we would consider a hip or knee replacement. So when my patients ask me, am I too old for a hip or knee replacement? I really discuss their medical comorbidities and whether or not they're in enough life discomfort and quality of life impairment to warrant one. I hope that answers the question, and please feel free to ask in the comments below. Otherwise, I'll see you for the next video. Thanks for tuning in.